Good afternoon. I'm Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services. And today I'm joined by Secretary Eric Boyette of the North Carolina Department of Transportation. David Payne and Brian Tipton are American Sign Language interpreters. Jackie and Jasmine Matevier are our Spanish interpreters. And let's dive into this briefing. As of this morning, there were 7,187 new COVID cases reported today. 3,666 people are currently hospitalized with COVID right now across North Carolina. And sadly, there have been 8,339 deaths since the beginning of this pandemic. As of today, North Carolina has administered 569,334 total doses of COVID-19 vaccines. That's over 500,000 vaccines, which is the 10th most in the United States. Hospitals, local health departments, and other vaccine providers have rapidly accelerated their rate of getting people vaccinated. Over the past 2 weeks, nearly 3 times the number of vaccines were given than in the prior 2 weeks. Our goal for vaccine providers is to use every first dose they have before the next shipment arrives each and every week. We will always have supply of second doses on hand to ensure everyone gets both shots, but those first doses need to get off the shelf and given to people each and every week. We are up for the task. Across the state, government agencies, businesses, and healthcare providers are coming together and partnering in new ways to make it happen. Everyone is working for Team Vaccine with a shared goal of getting North Carolinians vaccinated as quickly as possible. The state is aiding these local efforts by offering support with data entry or event planning, coordination across community players, pairing volunteer workforce such as vaccinators and registration assistants, help answering phones, and materials to inform people about vaccines. I want to thank our partners in the North Carolina Emergency Management and North Carolina National Guard who are helping us respond to staffing needs with rapid response teams. We also continue to scale up large-scale vaccination sites across the state. Governor Cooper and I had the opportunity to visit one in Orange County earlier this week. You could see the joy and relief on people's faces when they received the vaccine. Our sister agencies are also joining Team Vaccine. Governor Cooper is committed to deploying every resource to make sure people have access and are not held back by barriers like lack of transportation. That's why the North Carolina Department of Transportation is launching a program to pay for rides for people receiving a COVID-19 vaccine. Local transit agencies across the state are receiving $2.5 million in corona relief funding to make this happen. Lack of transportation shouldn't be the reason someone doesn't get their shot. Secretary Boyette is here with me today to answer questions about this important partnership. From the beginning, our plan has focused on delivering vaccine to all 100 counties. Now, while other states have adopted strategies to focus on high population areas and places with the largest number of healthcare providers, we sought to build capacity everywhere to ensure more equitable access to the vaccine throughout the state. Geography is only one part of the equation, though. All vaccine providers are responsible for ensuring that historically marginalized communities have equitable access to vaccines. That starts with meeting people where they are with event locations and partnering with healthcare providers who serve those historically marginalized communities. We are starting to direct shipments of vaccine to safety net providers such as our federally qualified health centers and rural health centers. But again, we're always constrained by the limited supply of vaccine coming into the state. Because the supply of vaccine is limited, we have to prioritize who can receive the vaccine first. We're starting by vaccinating people who are at the highest risk of being hospitalized or dying from COVID, and those at highest risk of exposure. Healthcare workers and anyone 65 and older can now get vaccinated. The limited supply of vaccine means that many folks will have to wait before a vaccine is available for them. While vaccines will be the best way to stop this pandemic, it'll still be several months until most people will have a chance to get vaccinated. So we cannot take our eye off the ball when it comes to prevention and slowing the spread of COVID-19. Today's COVID-19 county alert system shows that 99% of North Carolina counties are now red or orange. As of today, 86 counties are red with critical community spread, 13 are orange with substantial community spread. My secretarial directive remains in place. Please stay home and only leave your home for essential activities like work, school, or to meet your healthcare needs. If you must leave home or be with people who you don't know, wear a mask all the time. Stay at least 6 feet apart and wash your hands often. These things are making an impact. While our county report paints a continued dangerous picture, we are seeing some progress in our key metrics. Now, they remain much higher than we want to see, but they are stabilizing at the moment. Your hard work is paying off. The cases reported each day is down a bit from January 9th at over 11,000 cases. The percent of tests that are positive is still too high at over 11%, but it's down from its peak earlier this month at over 17%. Keep doing those 3 W's and staying home so we can slow this virus down while we get everyone a spot to get their shot. Okay, with that, I will open for your questions. Thank you.
Our first question today is from Vanessa Rufus with WCNC TV in Charlotte.
Hi, thank you for taking my question. I actually have a two-parter here. I wanted to see if you had any thoughts here with the new presidential administration, and we've kind of gotten an idea of what some of President Biden's plans will be to make sure that vaccines are rolled out quicker and some other things as well. But I just wanted to see what your thoughts are on some of these new plans. And my second question would be if you could just reflect on it being 1 year since COVID was confirmed here in the U.S. and just, you know, how far we've come, but how far we still have to go.
Vanessa, thanks for those questions. First, I'll reflect on yesterday's executive actions taken by the Biden administration. One, I want to commend the mask mandate. I know that is limited to federal property, but it very much fits hand in hand to what we've been doing here in North Carolina for more than half a year. I think masks are the #1 thing we need to continue to do to slow the spread of this virus. We know how this virus spreads. We know that masks work. And I applaud the federal leadership. I think that consistent message about masks is going to be really, really critical. I also appreciate the broad strokes of where the vaccine planning is going. I think the governor and I have had an opportunity already to share our feedback and concerns along with other governors in the Southeast about how the federal government can help us as we continue this vaccine rollout. Some of the things include just better communication and coordination so we know what allocations are coming to us. I've already shared feedback, the fact that the CDC data for North Carolina does not reflect the data we are seeing here in the state. You see our own vaccine dashboard shows over 500,000 vaccinations. CDC does not reflect that. So we just need better coordination and communication of the same information so that we can plan going forward. So I think all positive steps in the right direction. We look forward to additional federal leadership as we go forward. And I know we're very much looking forward to an additional package to assist our state in response and recovery from COVID as they work that through. And as I reflect on 1 year of being involved in responding to this crisis, it's been a hard year on every single person and family and community here in North Carolina. It's been particularly challenging, of course, for our team that's been in a state of emergency for nearly a year at this point. And so, we recognize the hard work that has gone on over this year, but it's not letting up now. And so we want to make sure that we are getting getting vaccines to folks as quickly as possible. We'll continue to work through that effort until everyone who wants a vaccine can have it. But I caution everyone that those vaccine supplies are very limited, so it's going to take a number of months before vaccines are widely available to everyone. Thanks for that, Vanessa.
Our next question is from Taylor Young with WLOS TV, Asheville.
Hi, yeah, this is Taylor from WLOS. I'm just going to piggyback off of the President Biden, his role now. I know that he's signing executive orders to expand testing, and just at speaking with local health departments today, staffing seems to be a major issue. Paying for firefighters and law enforcement to kind of work these clinics. Are you hoping that is addressed by the federal government through the Biden administration, or is that something that would be handled through the state?
Thanks for that question. I think our people resources have always been our most precious commodity through this entire response, whether that was to be able to surge our staffing in our hospitals and respond to COVID, or now as we are trying to make sure we have the staff and capacity to get vaccines out. So that continues to be a challenge. I heard a couple of very good positive movements forward from the federal government. One, they're committing more dollars and personnel to helping states, and we certainly welcome coordinating with them. They are moving forward with allowing for a higher reimbursement rate for the work that we are doing, the people resources that we are using, whether that's using additional FEMA resources. We applaud that in terms of making sure they're supporting the staffing work that we are doing. But I think it has to be a partnership because we need people and the dollars, but then we have to pair it to what's happening on the ground and making sure that it's coordinated with our operations on the ground and that it is particularly placed in communities that are underserved to make sure that we're getting access points to everyone as we go forward here. So staffing is continuing to be an issue, but I want to thank emergency management for helping us make sure that we can deploy staffing resources to our counties. We've had quite a number of requests and we've been able to act on all of those requests, and we're getting more and more folks out to our local health departments and other partners. And I was just on with our local health department directors all this morning and encourage them yet again to raise their hand if they need anything from the state. We'll coordinate with emergency management to continue to support folks as we go forward. Thank you.
Our next question is from Matt Mercer with the North State Journal.
Hey, good afternoon, Dr. Cohen. Two questions, one on testing and one on the vaccine. The World Health Organization recently released a bulletin indicating that the PCR test can produce the higher number of false positives. I know earlier you had mentioned that the departments and places that test do use those according to the manufacturer. Just wondering if that will change. And then secondly, the per capita vaccine rate for North Carolina remains around the bottom fifth of states nationwide. I'm just wondering if the department has a tally of how many doses of vaccine may have been thrown out since they started arriving in the state. You know, that's something we've seen in other states. So just wondering if that's something where the department has a tally of how many have had to be thrown away for any particular reason. Thank you.
Great, thanks, Matt. First, let me address the testing question in WHO. What my understanding is they released additional guidance to say follow the manufacturer's guidance on your PCR tests. And frankly, that's what our folks have been doing all along. So I don't think that guidance changes any of the practice that we are doing. We are already following our manufacturer guidance to understand what is a positive and what is not. So I don't think the additional WHO clarification changed anything for the testing parameters that we are doing here. When our labs say something is positive, they are following those manufacturer specifications that it truly is a positive. Now, on the vaccine per capita, this is where I was sharing that, you know, our data in our state on our state dashboard and what we are collecting currently does not match what is on the CDC website. There was actually about 150,000 dose administered difference between the two of them. So I'd caution everyone from looking at the various websites and where they're pulling data and when they're pulling it from and when was it updated. We're moving so quickly, which I am so grateful to for our vaccine providers, but we're moving so quickly that many of those rankings and charts are out of date. We've actually already flagged for the CDC to understand what the data lag and data discrepancy is between what we're seeing here in North Carolina and the data we do submit to them every night to make sure that we can line that up a bit better. Again, we've seen more than 500,000 vaccines given, more than 133% increase in the speed of giving those vaccinations. We want to continue to improve as we go, obviously, but our goal is to make sure we are using up all the vaccine that is coming to our state before the next shipment comes, so that we can be demonstrating to the federal government that we are using our vaccine effectively and efficiently here in North Carolina. Thanks.
We have a follow-up from Matt Mercer.
Yes, I understand about the rate, and I'll ask again real quick. Do we know how many doses of vaccine in the state have been thrown out? That is something, other states kind of report different times. And then also, we had an interview with Senator Phil Berger, and you participated in an oversight hearing at the General Assembly. Just wondering what kind of legislative ask you may be making, or the department will be making with the long session starting this month.
Sure. Apologies, Matt, for not getting to the how many doses are wasted. I want to start with our guidance to our vaccine providers is don't waste any doses. We are saying that if you are at the end of a day and you have 2-3 doses left over, but you're out of folks who fit that priority category, our recommendation is keep a wait list. Keep a wait list where you can call someone last minute to come in that does fit those priority categories. You don't ever have to waste it. But our guidance is also, if you even can't find someone on that priority list, find the closest arm of who wants to get vaccinated and get that in, because we as a state don't want to waste any vaccine. We are seeing very small numbers of vaccine waste recorded in our CVMS system, but it's very few, like in the tens of doses. But even that for me is too much. We don't want to be wasting here. There are always issues. As you know, these vaccines are challenging. They need to be diluted and then put into syringes. So none of this is perfect, but we are really encouraging folks on best practices related to getting as many doses as they can out of each and every vial, and then not wasting any at the end of the day. If it's out of the freezer, use it all, and make sure you're setting up your operations to be able to do that with wait lists and others who can come in quickly if that is needed. On your other question about our legislative agenda, certainly we're going to want to work together to make sure we have the funding available that was allocated by the federal government. It does need to run through the General Assembly before it can get to us and out into the community. So that's our first step, is to make sure that the money that the federal government has allocated to vaccines, that it is on its way to us, can get to us quickly, and then we can allocate it out to the work that is frankly already underway. We are already expending resources as if that's already here in our state, and so we need to make sure we get those resources out for vaccine. But remember, we also have ongoing testing needs and other needs related to our COVID response. So that will be our first priority as we work with the General Assembly. Thank you.
Our next question is from Will Michaels with WUNC Radio.
Hi, Dr. Cohen. Will Michaels at WUNC. I want to go back to the executive orders that President Biden put out, if I can. I'm specifically looking at the order to sort of mobilize FEMA to set up their own vaccination centers, as well as setting up a health equity task force to more evenly distribute the vaccinations to people of color and underserved communities. Do you anticipate that DHHS would change its distribution plan based on those orders in particular?
Well, thanks for that, Will. I think we need to understand additional details of what that means from the incoming Biden administration. I will say we welcome the assistance from FEMA on setting up additional vaccine sites, assuming that that also comes with vaccine. I think we're all running into the place where we have limited vaccine. We have now really ramped up our capability here to distribute and get folks vaccinated. So when I hear we'll help you set up more vaccine sites, we'll welcome that. I hope it also comes with offer of more vaccine with that. So I think those are the kind of details that we need to understand as we go forward. And as far as equity, that is clearly a priority for us as how we are thinking about it. I mentioned it in my opening remarks. I think there are some best practices both in allocation but in operations as well. For us as a state, we prioritize having access points in all 100 counties to make sure all communities had an access point across North Carolina. That was a choice we made early on. I think that was the right choice as we worked to mature and improve our operations in every part of our state. As we think about equity going forward, I'd love to work with the Biden administration on the kinds of strategies that they're thinking about. I think we're learning a lot about best practices from our partners on the ground and look forward to working with them to understand how they're thinking about helping elevate some of those best practices into vaccine allocations.
Follow up from Will Michaels.
Thank you, Dr. Cohen. And just for Secretary Boyette, if I could, I wanted to ask about details of this program to pay for rides to get a vaccine. Can you just explain what the $2.5 million will pay for in particular? Is it, I mean, how many rides in particular, for instance, does that cover?
Sure, thank you, Will. So if you look, we did an average of our cost per transit trip, and it's about $22 per trip for with this. And if you look, there'll be 4 trips, obviously, there and back twice for a shot. So it looks about 30 individuals that we'll be able to cover with this money. 30,000. Thank you.
Our next question is from Travis Fain at WRAL TV.
Yeah, hi, thanks for taking my question. I'm trying to understand the allocation of vaccine to hospitals versus county health departments. It's still an awful lot going to the hospitals, more than am I to understand that if you were in a county with a pretty robust hospital system, you do not necessarily have to reach out to your local health department, but your hospital system may be offering shots to people beyond their own staff?
Travis, thanks for that question on allocations. And what I should say is that while vaccine may get allocated to one provider, there is a lot of partnership going on at the local level. And so we've actually seen a lot of transfers of vaccine between partners who are able to vaccinate. So if a hospital has gotten more vaccine than they think they're able to get out by this Monday, then we are very much working with them to say, let's transfer that vaccine, whether it's to the local health department, to your federally qualified health center, or another vaccine-ready partner in your community. Just yesterday, that's one day only, we had 40,000 transfers of vaccine alone from one provider to another. So the allocation is one mechanism for us to get the vaccine out, but then it's really becoming a very nice partnership in the local areas where we see the hospitals and local health departments and other providers work together to get that vaccine out, right? We all share that same sense of urgency to get vaccine out to our communities as quickly as possible. And so I'm really appreciative of those who are willing to transfer and partner to make sure that this vaccine is getting out. For a person in the community who's saying, where do I go? How do I think about where I can get vaccine? I would say start with your local health department and your local hospitals to understand, are they taking appointments? Are they creating wait lists? How can you access those? And again, you don't have to be confined to your county. Counties can and should and must be serving all jurisdictions. By the fact that we take in this federal asset, these vaccines are paid for for by the federal government. They're not supposed to be limited to that one location or one county. They do sign an agreement with us to make sure that they are serving folks beyond their county borders as well. Thanks.
We have a follow-up from Travis Fain.
Just to be sure, if I'm reading the spreadsheet right, and I'll admit that's an if, hospitals are continuing to get the vaccine in significantly greater numbers than health departments. And that is not because they are continuing to have that much staff they need to vaccinate, is it? Is it because of the mass facilities that they're going to be standing up?
So I think it depends on the situation. Let me speak to the one, for example, this week that the governor and I visited. It was run by UNC Health, but it wasn't at the hospital. It was at the Friday Center. It is open to the community. So there are a number of those events: Novant Health, Atrium Health, Cone, Vidant. I'm missing people and they're going to be sad that I left them out, but all of them are doing large throughput events like that where they're partnering with their communities. I got a text this morning of just one mobile site that is at a parking lot in an African American church in the Charlotte area. So those are the kinds of things that are happening. Now, yes, it is allocated to the hospital, but again, they partner then with some of their local entities. For us, we wanted to make sure we were getting vaccines to those who could commit to us that they could get vaccine out quickly. Sometimes that was a local health department, sometimes that was a hospital. We're just working with the partners who are raising their hand and saying, I can go fast, I know how to do this with equity, and those are the partners who we are working with.
Our next question is from Daniel Pierce with Fox 8 News in High Point.
Yeah, we're hearing that hospitals and health departments are running low on vaccine supplies, or lower than they had anticipated right now. And we are having some counties tell us that they are expected to not get any vaccines next week. So my question is the state running low on vaccines? Is it behind schedule? And what should people that have signed up for vaccines over the next couple of weeks expect?
Daniel, great question. That is our goal, to run out of vaccines every week before the next shipment comes. And that's what we have directed our local health departments and hospitals. And so, yes, we are running out of vaccines in all places. Now, I'm not surprised that they don't know what they're getting next week. It's because they haven't gotten their allocation yet. We are on a week-over-week schedule. Now, we're trying to forecast out for our local health departments and hospitals so they know how to plan. We've said you should assume about what you're getting now is what you're going to get in the future, assuming that you are able to continue to get out that vaccine in a timely manner. So we are asking our partners to, quote unquote, run out of first dose vaccines, and I want to clarify that, run out of first dose vaccines before their next shipment comes. Shipments come generally on Wednesdays, and it is the Friday before, so tomorrow is the first time they will know what their allocation is, but that shipment won't come until next Wednesday. So I think as we sit here on a Thursday, it is right that a local health department doesn't know exactly what their shipping that they're going to receive next Wednesday is. But we have been trying to forecast out for folks to have some understanding so that they can plan, they can take appointments. But yes, the goal is to run out of vaccine by Monday or Tuesday. So by the time shipping comes on Wednesday, they're starting with that new allocation of first doses that comes to them. I think you're going to hear this more and more. We've worked through getting out the vaccines that we have on the shelf, and I think you're going to hear more and more. We need more. And I think that has been our consistent message is we have limited supply, and it's going to take some time for us to get vaccine to everyone who wants it. So we're going to keep working as hard as we can to get the vaccines out that we get from the federal government, but ultimately the overall supply still is limited. Remember, we get about 120,000 new first doses week over week. So that is the number that we are aiming for as a state every week, to do those 120,000 vaccines as first doses week over week. Thanks, Daniel.
Follow up from Daniel Pierce, Fox 8.
So I know that even here in the tribe, we've had a couple clinics for vaccines that have had to be canceled because they've run out. And I know it's probably getting frustrating for some people that continue to sign up to get these appointments just to hear, oh, it's been canceled. So I guess what is your message to them about kind of their anticipation, their anxiousness, and even their frustration about trying to get a vaccine and trying to get through this?
Yeah, Daniel, look, I understand with the limited supply of vaccine that this is going to be a challenge for all of us when we don't have as much as we would like. First, I would say when folks report to us that they are running out and they have something that is scheduled already and have appointments, we work very hard to see if we can figure out a transfer, meaning that there's vaccine somewhere else in the state that we might be able to get them. That happened 2 or 3 times just yesterday that I happened to hear anecdotal stories of. So we're trying very hard to make sure that we are moving the vaccine to places where folks have appointments, but it's not going to be perfect. We are just figuring out what is our operational tempo, how much vaccine can we get out each and every week so that we know how to best schedule appointments. That's why we're asking folks to move to a cycle where they're keeping wait lists as opposed to having to cancel appointments. That way they can always add, and that's great news. If someone comes off that wait list, they're always super happy, but as opposed to having to cancel appointments. So I think that's the mechanism we're trying to do to manage this slight bit of uncertainty as we move week to week. I'm hoping as we get more information from the new Biden team and more certainty about what is coming, hopefully we can forecast out even further for everyone as we go into this, and it will become a bit more smooth.
We'll take our final question today from Christy Murphy with the Morganton News Herald.
Hey, Dr. Cohen. Thank you for taking my question. I am really curious. One of the things that we are seeing here is that people are just frustrated with trying to get through to even talk to someone about a vaccine. And we're seeing so many different practices on how counties, local health departments, and vaccine administrators like hospitals are signing people up to get the vaccines. Is there some kind of best practice that the state has given to local health departments, hospitals, other vaccine administrators on how to have people calling in or going online to sign up for the vaccine?
Christy, thanks for that. The short answer is yes, we have given folks some best practices. We're also offering help and support for our local entities. Could we help them with reinforcing their phone lines, just answering the phone, whatever support we can help with. You know, we did make a decision as a state to not centralize appointments. We did not want to add another layer of bureaucracy between the state, the vaccine provider, and ultimately the person getting the vaccine. But we do know that means different systems and different locations have different ways of getting someone into an appointment or onto a wait list. We do have our website that has all of our vaccine sites. You can find it at yourspotyourshot.nc.gov. That is where we try to keep an updated list of our vaccine providers, their either main phone number or the way that you can contact them online. And again, I think as we're learning here, folks are getting better at knowing how to schedule, creating wait lists, and so we hope to be able to continue to improve as we go. But I think, as Daniel's question really pointed out, we are in a point where the supplies are truly limited, and everyone's going to have some patience here as we work to get more vaccine into the state over a period of time. So we'll continue to keep you updated on the latest numbers as we go. I don't hear a follow-up, so I'll assume we closed out for today. I want to remind everyone, I know we focus almost exclusively on vaccine for the questions, but remember, there is still a lot of viral spread in North Carolina, and there's not enough vaccine to go around, so we really have to focus still on doing those tried and true things that we know work. Wearing a mask all the time, waiting 6 feet apart, and washing your hands. Remember that the secretarial directive is still in place. Please, if you can, stay home and protect yourself, your family, and your communities. Only go out for essential for reasons. Please don't have people over your home indoors. Please don't go to their home indoors. Take care of yourself and stay well. Thank you so much.